Our passion didn't start with the mouth. It started with people, with the well-being of the profession. And if you're like me, maybe a little bit of your nerdiness and all things tech too. We all want to love what we do, but the truth is, burnout, people problems, and glass ceilings can keep us from doing what we set out to do. So let's get back to the heart of connection. Welcome to the Dental Handoff. This show is about passing you the knowledge, the habits, the systems, and the strategies to lead your teams, lean on your tech, and listen to your gut while you take care of people and truly the overall health of our communities. Let's stop using the wrong end of the toothbrush, y'all. My name is Dr. Kelly Tanner. Oh, and uniquely, I'm a dental hygienist too. You can consider me a guru in the dental and leadership industry. With over 3 decades of experience, my goal is to take you to the next level by empowering growth, perspective, and confidence. By identifying the gaps, recognizing the plaque, and extracting the truth with the other experts in the field. I'll share their stories, empower you to own yours, and elevate your passion in the process. So have a seat in the chair, put on your bib, and let's get to work. Welcome to the Dental Handoff. I am Dr. Kelly Tanner, your hostess, and today I have with me the India Chance from Learn2Prevent and also a personal friend of mine, India. Thank you for being on the show today.
Thank you for having me. I'm excited to be here. Yes.
Me too. India, you and I met, I think, when around COVID time, didn't we?
Yes, we met around COVID, and then we had the opportunity to kind of hang by the pool a little bit.
Yes, we did.
One of the conferences. Yes.
That was a fun day where we it was a collaborative event.
Yes.
I think, Dr. Joyce was there. You were there. Who else was there?
Shriti was there. Ruparelia, she was there. That was pretty fun. And we all just had a post kind of conference session by the pool. So that was pretty fun. Yeah.
Yeah. And then we set some goals. I think we did some goal setting, didn't we?
We did. It was very productive. I really enjoyed it. I'm like, we should have more conferences set up like this.
a post-conference debrief.
Right.
Goal setting.
Exactly. Yes, for sure.
So I always start with the question, why dental hygiene? Did you choose it? Did it choose you?
I will tell you that I was in college and I was a business and advertising major, and I was not enjoying it. It was very different than what I thought it was going to be. And so I was kind of like undecided. And my mom happened to be working, she worked for the state that we live in. She worked for the state government, and there was an oral health department there. And with her job, she had to work with them from time to time. And there was a dentist that worked, he was the director, and she must have been talking to him one day about, my daughter's undecided. She doesn't know what she wants to do. And he's like, oh, she should become a dental hygienist. And my mom's like, oh, that sounds fabulous. I'm going to talk to her about that. Can I have her call you? And so she connected us, and I ended up chatting with him. And he just, the way he presented it to me, it just seemed like it might be something that I was really interested in. And so he recommended, hey, go become a dental assistant first and see if you like it. And then, pursue it, because he's like, dental hygiene is really great. And at that time, there was a shortage similar to now. It's like, it's cyclical, right? And so there was a shortage, and the dental hygienist that I had at my dental office, I just thought she lived the most fabulous life. She just kind of like waltzed in, took care of my teeth, waltzed out. Little did I know, right?
Had that play out in real time.
Yeah, right. She just made it look so glamorous. So I thought, I might be able to do this. So that's kind of what got me on the journey. I became a dental assistant, loved it. Started when I decided that I really liked it, I made the decision I'm going to become a dental hygienist. And so that's what I did. I kind of researched, what do I need to do to get into a dental hygiene program? Where are the dental hygiene programs in my state? And so I started with prereqs. I was working at a dental office while I was taking my prereqs. And what was really a blessing for me is that I happened to be working at a practice where the dentist, the owner, was very pro education. So he
Mhm.
really encouraged all of us to excel and go beyond what our current position was. And when he found out I was going to dental hygiene school, he was very excited. They were so happy to have me there. And I was like, oh my gosh, and so he never, tried to discourage me in any way. He always would talk about it and encourage me. So I just was, I just happened to be in the right office and it worked out really well. And I went to dental hygiene school and the rest is history. Yeah.
So that person, the first office you worked in, they invested in you and they saw something in you.
Oh yeah, yeah, definitely. For sure. I think without that encouragement, I'm not sure. I mean, I would have still become a dental hygienist, but I think that the way that they supported me really solidified my decision. And I'm like, okay, I'm doing the right thing. Like this is, what I want to do. So it was really good. It was a great environment for me.
I had a dentist I worked for a few dentists in a group practice when I first started. And right out the gate, they invested in the team. They sent us out to Las Vegas for dental conferences where I didn't even know all of that existed.
Yeah.
But I feel like that first interaction with the dental office and them, because when you come out of hygiene school, you have a certain base knowledge of what
Sure.
there is. And then they have certain things that they have to teach too.
Right.
And they have to prepare you for the boards, but then there was so much more to, and you start to peel back the layers of
Yes.
what you didn't know. And so with that, I think for me, and tell me if you agree with this, it opened a whole new world where it just made me more eager to learn.
Yeah. Yeah. I know. I totally agree. I think from my perspective, I think it takes a good 3 to 5 years for you to be able to like really learn about what dental hygiene really is. Like you said, school is just the tip of the iceberg, right?
Mhm.
You come out with just the bare, I mean, it's just the basics. And it's not until you get into practice and you're starting, even with just, I would say, not just education and learning what dental hygiene is, but also your practice philosophy, instrumentation, how you're going to take care of your patients, things like that. And so I think it's important for new hygienists to understand that, it takes a while for you to get into the groove and really understand what dental hygiene is, what it can offer you, how you can excel in it, and really create a really nice career out of it. It is a profession. It's not just a job. And sometimes I'm running into opinions and perspectives where it's coming off and landing on me as if like, this is a job, this is what I'm doing now. And I'm like, oh, it could be so much more than that. Let me tell you, let me tell you what else it could be for you. So no, I totally agree. And I also think it's important when, as a hygienist, when you're going to work at a practice or a dental setting, it's important to have that as part of your interview questions for that particular workplace, because if they're not supportive of education and you growing and expanding, and I don't know that it's always the best place to be. I
Mhm.
think that you really need an environment where you can thrive and just elevate in all areas. And I think working for a practice or any dental setting really that's going to support that, I think that's the way to go. But we often don't ask those questions, right? When we're going in to
It's
be interviewed,
true.
we let them interview us. We don't interview them.
Right.
Yeah.
Yeah, and I've been in a situation too where I've worked for when I was out actively interviewing when I was a baby hygienist
Yeah.
and all of that evolving where I would ask about those things, and it seems almost sometimes where the offices would get sort of turned off because they were
Sure.
like, "Where are you gonna go? Are you gonna use us to grow?
Right.
Are you gonna grow on our dime and then leave?" And that is such a scarcity mindset, which I can't even put my head around because anything that I'm learning, I'm bringing in, teaching the team, updating the team on what I've learned because that's just my heart in it. But
Yeah.
I think that the reality is some offices are threatened by people knowing and learning more.
Yeah, yeah. Oh, yeah, because they do. They think that you're going to just use them as a stepping stone. But what's interesting is I was doing a course and I had to do a little research on the benefits of educating your team members on a new skill, like you as the employer providing your team members with a new skill. And there was a huge survey that was done. I can't remember who did it, but it was a huge survey that was done. And basically, they surveyed employees, and they found that you're 5 times more likely to keep an employee if you provide some form of continuing education for them. Basically, you cover it for them,
Yeah.
and or you encourage them to get a new skill and bring that new skill back to the workplace. What it does, what they were talking about and what they were saying, is that it can reduce burnout. It can remove the mundane day-to-day doing the same thing every day,
Oh, yeah.
creates a little bit more excitement, more engagement. And so I was like, ooh, if these practices could, get this information, this would be great, because now with the shortage with, different team members, whether it's auxiliary or your dental hygiene or your dental assistant, it's like, uh, you know, getting them engaged more into the practice, I think would help a lot of with the shortage with some of these offices that I walk into.
I completely agree. I mean, if you think about 401k, if you
Yeah.
think about
Yeah.
health benefits, they're
Yes.
all a way that they are investing in their team. And it is also an additional investment.
Yes.
And then
Yes.
also too, I do hear hygienists who say it's my doctor's responsibility to do this.
Sure.
And I don't know that I necessarily agree with that as your professional responsibility and oath that we all took to
Right.
be continual learners to update on the information because it's changing. It always has changed rapidly.
Sure.
By the time
Sure.
you learn it, it's almost outdated, kind of like infection control.
Right, right, right. Yeah, no, no, I agree. I think that it's a responsibility of both the employer and the employee. So it's a responsibility of the dentist, practice owner, and the clinician. As a hygienist, it is important that we continue our education regardless if our employer is going to provide that for us or not. We do have an ethical responsibility to make sure that we are taking care of our patients to the best of our ability. And part of the code of ethics for dental hygiene is continuing education,
Yeah.
learning, participating, in different disease prevention and health promotion activities.
Mhm.
And continuing education is one of those. So, yeah. But also too, I think it's an opportunity for hygienists when, if they do have an employer that doesn't, provide certain things for them, I think it's an opportunity for the dental hygienist to actually advocate for themselves
Yeah.
for a raise or for new instruments or all these challenges that we have in the
Right.
practice, that we're like, oh, my doctor won't buy me this or my doctor won't do this. I think the more valuable we can become, I think, and learn how to advocate for ourselves, I think there's a new type of conversation that can happen with
Yes.
your doctor that could potentially yield the results that you want
At a higher level.
at a higher level. Yes, for sure.
Yeah.
For sure. For sure. Yeah.
Love
Yeah.
this. So, Andia, you went on to be a clinical hygienist.
Yes.
And what happened with your career after that? I love to hear these stories.
Well, I right out of the gate, I went right into a lot of public health dentistry. So I'm really, at heart, I'm a public health girl all day long. And I did a lot of working in, volunteering. I worked in a lot of, low income areas, a lot of like dental clinics, FQHC, things like that. A lot of, at the time in my state, there was a DSO that was mainly focused on patients who had state insurance, and so we got to see a lot of patients that were really underserved in a lot of ways. And so what that did for me was really kind of help me to understand one, of course, the importance of, dental hygiene and, home care and all of that kind of stuff. But it also allowed me to expand just as a healthcare provider in general and really be able to see that there are a lot of just people in our community that really need to be educated a lot more when it comes to oral health. There were so many things that, people just weren't taught, they didn't know, and all these myths that I was able to just bust, you know what I mean? Oh, you only go to the dentist when your teeth hurt, or, oh, it's a baby tooth, so it's just going to fall out anyway, those types of things. And then from there, I ended up becoming a team leader in a school program, a school dental program, where we did full on dentistry in the schools. And so we went from school to school to school. I was the team leader. I was a supervisor for a dentist, a dental hygienist, and a dental assistant. And that was really interesting too, because the dynamic typically is the dentist is in charge of the hygienist, but this was flipped. And so it really, really gave me an opportunity to hone my skills as a leader, basically run a program. I provide, I had the van and I have all the equipment and I'm driving to schools and things like that. But again, it was a lot of, public health. But it was really interesting to see, how everything could work. So that was really exciting. And then I ended up moving to a different part of my state, and I got a job with Waterpick as a professional educator. And so it was a non-clinical position, and I was doing lunch and learns and going from office to office, and that was really, really a fun time for me because I was dipping my toe into the non-clinical side. I was seeing what was out there, and I thought, oh, I love this. I love the non-clinical side because for me, by that time, I had been in dentistry a long time, since the 90s. And this was like around 2015. And so I was like, oh yeah, I kind of need to expand a little bit. And so this really taught me how to present, how to, put on an educator hat or a trainer hat versus, the clinical hat, the dental hygienist, just, educating about oral, not just, but educating on OSI, right? And so I got to remove that just word. I gotta remove that. I always say that. I'm like, no, it's not just, it's not just. But yeah, so it really kind of helped me to develop my trainer skills. And then from there, I had a phone call one day. A friend of mine said, India, you have a lot of business acumen. We've been friends a long time. And there's an office that needs help with building their dental hygiene program. And I said, I don't know if I want to do consulting. I'm not sure. And she's like, well, just help them out. You don't, just give them like a 6-month contract and be done, but they just really need help. And I just think you're the perfect person for it. So I was like, okay, I'll do it, whatever. Because I had helped like internally build dental hygiene departments, within practices and stuff. Right. So I said, okay, this can't be that hard. And so I started doing that. It was working out great. I really made a huge impact in that practice. And one of the ways that I helped them was I'm a big advocate of education for myself. So I thought, well, if you're going to hire new dental hygienists, this is a great, benefit. You're not giving them a 401k, but here's another benefit that might fit within the budget that would be a little bit easier for you to do. And that's offer CE, have people come in, provide lunch and learns where CE is attached. And this would be a way it's a benefit. And it's also a give back to, your staff and stuff. And, they were like, okay, let's do it. And so the dentist comes up to me and she's like, oh, by the way, we want to have a trainer come in for OSHA. And here's the person, here's her name. And we need you to call her, we want one of the lunch and learns to be OSHA because we know we need to do it. And I said, okay, no problem. So I give her a call and we're talking and I'm, telling her what's going on with the practice. And she's like, okay, let's get scheduled. And we get scheduled. And at the very end of the conversation, she says to me, do you mind if I ask you a question? And I said, sure. And she's like, what's your end game? And I'm like, and so, you know how there's some words that really like pique your, and I'm like, end game. It's like buzzwords for you. And I was like, that really registered with me. And I was like, well, what do you mean? And she's like, well, I'm inquiring because I just want to know, like, what are you going to do with this? Like, you're consulting and this, that, and the other. And I said, well, I wasn't sure, I'm not sure. This is kind of, temporary. And she's like, well, I'm retiring and there's going to be a need in this area for an OSHA and infection control trainer. And if you're interested, I'd love to have another conversation with you about this. And I'd love to kind of talk you through this and see if this works for you. And I was like, yeah, I was like, sure. Because I knew at that point that I liked non-clinical. I wanted to still be in dentistry. I wanted to lean on all my education and experience. And I knew this industry. I knew this industry really, really well. And I was like, yeah, let's definitely. And so fast forward, I had a conversation with her. She ended up retiring. I just started building my business. And since I've just become basically who she was in our area, as the leading, compliance consultant and trainer in our area, but it's all because she kind of just asked me a question and I was, I walked through the door, I guess, you know what I mean? But yeah, that's kind of how I got to where I am today and where my career is now. So, yeah.
And you just went into consulting just to check it out.
I just did it really. I don't even think I went in to check it out. I think I did it as a favor to a friend because she kind of was like, Indy, I already kind of told him that, you were the best person for it. And, and I was like, okay, all right, I'll do it. It was literally the office was right down the street from my house and my son was in school. And I'm like, okay, this will be quick for me to go back and forth and stuff like that.
So you did that for 6 months. And then what were maybe the top 3 things that were most surprising to you about being a consultant at that time?
I think one of the things was how I just thought when I walked in that everything I recommended was going to be accepted. And they were just going to do what I said. And based on all of my knowledge, they're just going to do what I say. And that was not the case at all. Even though it might have been the right thing to do, that was not the case. That they just, there was definitely, they didn't want to follow everything that I recommended. Another thing that was surprising for me, which I didn't realize till I got in, as a consultant, when you're making a recommendation, you have to understand that the practice owner has a lot of things that they have to consider. Yes. And change is not always fun, right? Nobody likes change. And so their concern is, okay, if we make this change, how's this going to affect the team? I don't want to lose anybody, right? I don't want to lose anybody. I don't want any disgruntled employees. So that was a learning experience. That was something new for me I was like, oh yeah, okay. So now moving forward, when I make recommendations, I've got to keep that in mind. How is this going to affect the team? So when I'm presenting the behavioral change to the dentist, hey, this is how we're going to do this. This is the process. I have to keep in mind their concern as well. So that was I would say that was the number one. The number 2 thing I think that was a little surprising for me was managing expectations. I think sometimes the expectations are different. And because I was brand new, I didn't really have the expectation conversation at the beginning. I kind of had it after we were already in. And so, they were thinking, oh, you're going to come in and make our practice $1 million practice. And I'm like, whoa, you just asked me to come in and help your dental hygiene department. Right. So I think, managing the expectations was, doing that right at the beginning is very, very important. Because then that way nobody's disappointed because you know what I mean? You know what to expect. As long as you meet those expectations, meet those deliverables, those deadlines, you can walk away with a happy client. And yeah. And then the third thing that I realized is I did not want to be a consultant I did not want to be a practice consultant per se, where you help build dental hygiene departments, or you help with billing, or you help with all of the things that, practice consultants do. I
Mm-hmm.
realized that I wanted to hone in on one area
Yeah.
where I could quickly go in, help them, consult you, and then I'm out.
Yeah.
And that was where that's where I feel like I can be most effective. And that is why I made the decision, when I really began to understand what a compliance consultant did and how they worked with the office. I thought, this is like, the clouds opened up. It was like, and I was like, oh my God, this is it. Because
Yeah.
too, it also connected with my personality, because my 5 strengths are, one of them is strategic, futuristic, so I'm in the 5 strengths. I'm executor. And so in execution. And so when
That
I
sounds kind of daunting, that execution.
execution, like I'm all about and
Yeah. Yeah.
strategic.
Make it
And
happen.
so make it happen, and checklists and things like that. And in compliance, that's what that's all about. It's all
Yeah.
about a checklist. It's all about a rule. It's all about a regulation, and it's all about getting those implemented quickly. And I was like, oh my God, this is so perfect. And I can say that I love what I do. I mean,
Mhm.
I just absolutely love what I do. And I never thought, there are parts of the times in my life when I was in dental hygiene, and I'm like, I don't know that I love it. And I think I really need to love it. So I was always on this journey to find my space and my niche, to
Mhm.
see, how can I love this? Because I want to take care of people. I want to help other people take care of people. It's part of who I am, part of my faith. And I know dentistry. I've spent so much time, so much money in education and stuff like that. And what can I do? And I just kept walking through doors and putting one foot in front of the other. And I finally found it. And I'm like, here I am. And so that's kind of been my journey to get into compliance.
Yeah. So you focused on backing up a little bit,
Mhm.
you took the faith to believe in yourself, to say, yes, I'll do you a favor.
Yeah,
You
sure.
learned a lot. You learned a lot
Yeah, yeah,
about yourself through
yeah,
that. It's kind of like dating, where you're
yeah,
like, I do want this. I don't
yeah,
want that.
yeah,
I want a little
yeah,
more over here, not as
yeah,
much over here.
yeah.
But then leaning into your gifts and strengths. And I think
Mhm.
it's so important too that you bring in the strengths finders,
Yeah,
because you had to know yourself, and to
yeah,
know that that's where I think that opportunity met the learning of yourself, to go, oh, and to open
yeah,
the tools up.
yeah, yeah. I think if I would have learned about strength finders in the beginning, I would have, like, towards the beginning of my career, when I realized, yeah, I love clinical hygiene, but I want to do something else, or I want to do a little bit more. I think that would have helped me a little bit to kind of hone in on exactly what I want to do
Yeah.
non-clinically. That's the biggest question that I get from dental hygienists when I go into offices and I'm doing the team training and stuff. And they're like, well, I want to do, how did you get into this? Because I want to do something, but I just don't know what else to do. How can I find out what else to do? And my answer to that question would be, take a strength finders, right?
Yeah.
Take the strength finders, find out what your top 5 are. I mean, I would say take the whole thing and find out all 34 or whatever, but your
Right.
top 5 are going to give you a really good idea of what your gifts are, what your strengths are. And then you can begin to look at the non-clinical type of positions that hygienists can hold and see what matches,
Yeah.
instead of, failing forward like I did. Like, I just like fumbled my way through a lot of times, and I was like, oh, I'll take this up. No, I don't like that. And, and it was sometimes at times it was jumping around. That could be a good thing, but it also can be, it can be frustrating
Yeah.
too, because you're like, "Ugh, I keep choosing something and that's not what I want to do. And I'm not happy in that." And I just, so I think the strength finders will give you more of a framework to
Yeah.
really find out what would be the best fit for you, I
Yeah.
think. Yeah.
I
Cause
agree.
there are certain things like, I know a lot of hygienists who are in sales, and you have to have certain strengths for that. You have to have a certain type of personality to love it. And I know a lot of hygienists that are in sales and they love it. And then I
Yeah.
know a lot of hygienists that are in sales and they're like, I'm just doing this because whatever,
Right.
But I would say that I think that's where, looking back, that's where I would start first and then, move forward. But then, there are times where you're just going to have to try something to see if you don't like it. Because sometimes you don't know what you don't know.
That's
And
right.
so if you don't do it, you're not going to know if you don't like it.
You learn.
Yeah. Yeah.
You
Yeah.
you know, you fail, you win, you fail, and
Mm-hmm.
you learn, or
Mm-hmm.
you win,
Mm-hmm. Exactly.
it's just like that. So as you're I talk about all the time that it's not a linear process that we go through.
No,
And
it's not.
it's not intended to be that way, because if you never tried something, you wouldn't learn how to challenge your
Yeah.
gifts, and you could just be here and holding all these gifts, but
Mm-hmm.
until you apply them, you don't know which ones are your strengths, what you're enjoying. And
Right.
so I love that you said that.
Yeah.
So India, now you are full on entrepreneur. You're
Yes.
doing this full time. You're speaking.
Mm-hmm.
You are going into practices. You have a team
Yeah.
expanding.
Yeah.
So how do people get more of you? How do they reach out to you, consume your content?
Yes. Well, I'm on social media, of course. Certainly could visit our website, Learn to Prevent. Let me move out of the way. There you go. Learn to Prevent. There you go. .com. That's where you can check out what we do. On social media, all the handles are Learn to Prevent. Um, we host events. I do team trainings. I'm speaking, all of that kind of stuff. So certainly check out the website. See what's happening, what's new. Reach out if you have compliance questions. I'm
Yeah.
your girl. Just reach out, that kind of thing. But yes, this is what I'm doing full time. I've built a really successful business, and just really excited for what's coming next. Yeah.
Yeah, well, there's so many changes, and it's good to have those folks who you can reach out to. I mean, I know that I reach out to you or anybody
Yes.
else like, "Eek, what do
Yeah.
I do?" And it's nice to know that
Right.
you're supported, because you
Yeah.
don't know, or when people think that they know something, to go in and to, like you and I were talking earlier backstage, to go in to correct also what
Yes.
people think was right.
Yes. Yes, that is definitely a challenge. There's certainly a way to do it and not just come in. I always tell my clients that I'm the coach and not the sheriff,
Mm,
because, you have to respect what people, number one, you have to respect what they know, you have to respect their experience. And I learn things from my clients all the time. I learn little tips and hacks, and as long as they're within the guidelines, I'm like, okay, let's do it. I love that hack, or I love that tip, or oh my
yeah,
gosh, this is a great way to do it. So yeah, I think just reminding everyone that I'm a coach, I'm not the sheriff, so I'm just here to kind of be shoulder to shoulder with you to make sure we cross the finish line.
yeah,
That's really my
awesome.
job.
Well,
Yeah.
thank you so much for being on today. I'm just so grateful for you and so proud of you and everything that you're doing. How to get in touch with NDA is in the show notes. And for our viewers, thank you so much for what you do every day. If I always ask, please go on to Apple and give us a 5-star rating, the Dental Handoff, 5 stars, and then go on over to YouTube, share, subscribe to all your friends who you love. Have a great holiday, everyone. India, thanks again.
Thank you so much. I appreciate you having me. Thank you, everyone. Thanks for listening.
Yes. Be well, everyone. Take care.